So,
Special sound for Chalani, yan.
what is the time now?
1 o'clock.
1 o'clock. Okay.
12:10.
So forget that. So when the baby cries, there is oxygen going inside the lung, and the lung will start to contain air. If air and oxygen there, the body need blood to carry the oxygen to the body. So this is what's happening. Now the blood can go freely to the lung, carrying the oxygen to other parts of the body, and the baby will have the transition from intrauterine to extrauterine. Okay, so what's happening in pulmonary hypertension? This point failed to happen. The blood vessels remain constricted and is not opening in response to oxygen. Okay, so if the blood vessels fail to respond to oxygen, it will remain constricted. Still, the baby will have pulmonary hypertension, which he take it from intrauterine to extrauterine life. Okay, so this is the primary pulmonary hypertension. What about secondary? The baby has meconium or has diaphragmatic hernia or have lung hypoplasia. Initially, the blood pressure in the pulmonary circulation will not be high, but because of the difficulty of the clinical condition, he might develop secondary pulmonary hypertension. So secondary means it will come later. And this is in this case, the baby has hypoplasia and he developed secondary pulmonary hypertension.
So this is secondary, not primary.
Yes, secondary pulmonary hypertension. Because the baby has pulmonary hypoplasia, which leads to pulmonary hypertension. In pulmonary hypertension, the blood pressure here is high. The blood cannot pass to the lung, even with the effect of oxygen. It's not doing anything. So there is a back pressure.
Hypoplasia, there is pressure here, doctor.
Yeah.
Yeah, the pressure is still high. The still high. Yeah, it's not opening. So the right ventricle find difficulty in pumping the blood to the lung. So the right ventricle will enlarge. The right atrium is pumping the blood to the ventricle, and the ventricle has a high pressure. So what this will cause for the right atrium? Enlarge. Secondary to ventricular, ventricular dilatation. So this baby has in his echo right ventricular and right atrial dilatation, which reflect pulmonary hypertension, right? Okay, so if this baby has high ventricular pressure now, and this is high pulmonary pressure, so the ventricle try to pump the blood to the lung, but when the valve want to close after passing the blood, pulmonary valve, the blood pass to the lung, but because here is high pressure, the valve want to close after that, as if I am pushing the door here and you try to open it by force. If you lift the door suddenly, what will happen? Bang. I will push the door forcefully. This is what is happening in pulmonary hypertension. The blood passes through the pulmonary valve, but because of high pressure here, it pushes the valve cusps to close it with a sound. So what we can find clinically here, high intensity of S2. It is due to the pulmonary component of the heart sounds. Okay, so this is what it will explain the high second sound. Something else. This is the ventricle. This is the atria. This is the ventricles, and this is the interventricular septum. Classically, left ventricle should have higher pressure than the right. Okay, so
That's the normal, doctor.
yes. So what will happen for this septum? The septum is deviated little to the right ventricle. So here we'll find like this. Okay, some bulge of the septum in the right ventricle. But if the right ventricle is facing high pressure from the lung, it will increase the pressure here, flattening this. So this one will be flat, not bulging inside. So flattening of interventricular septum is a sign of pulmonary hypertension.
But this will be normal, doctor. It's
bulging. This one is the normal.
This is the normal.
A little.
This is the straight.
This
Straight
is left, doctor, na?
This is left.
A little deviated
This
to
is
the
right,
right.
to the right, because
Yeah.
of high systemic
But because
pressure.
of there is high pressure here,
Yes, so this is high,
high pressure
and
also,
they flatten
then it will
the
go
interventricular
really
septum. Okay, So if you read the comment of the echo here in this patient, you will find there is flattening of interventricular septum, okay, and the dilatation of right ventricle and right atrium. Fine. This is how we do, how we diagnose pulmonary hypertension.
The tricuspid regurgitation, it's happening here, doctor.
Why regurgitation will happen? It is tricuspid regurg.
Okay.
What is tricuspid regurg? Between the right atrium and the right ventricle, there is a valve called tricuspid valve. Tricuspid, three
valve.
leaflets. Okay. Now, the ventricle want to pump the blood to the lung against very high resistance. So what's happening when contracting? The tricuspid valve will leak some blood because of the very high contraction of the right ventricle. It will leak some blood in the tricuspid valve, and this is another sign of pulmonary hypertension if you have tricuspid valve regurg. Okay. Yes.